Alright, so then now we're going to go through similar type of stuff for the lumbar spine and the lumbosacral plexus. So this is the lumbar plexus. It's mostly going to come up from about T12 to L, I think L4, L5 maybe. And this is the yellow, and then the green is going to be the lumbosacral, or also called the sacral. So you can see that it's coming from some of the lumbar spine, and then also from the sacral segments as well. So there are a few dermatomes that you talked about on the torso. Obviously there's not going to be any, well there is abdominal reflexes I think. We're mostly going to get into the lumbar segments, but there are a few landmarks for dermatomes. T4 is going to be approximately at the nipple line. T7 is about the xiphoid process. T10 would be around the umbilicus. And then T12 will be around in the inguinal area here. T12. So I mean T12L1 is pretty much this inguinal ligament area, is dividing between the thoracic and the lumbar. So T2 to T12 is going to be the intercostal muscles. So this beaver sign is if somebody's doing like a sit-up and you watch for the umbilicus to deviate from one side to the other. So if some of the muscles aren't working uniformly, you'll see it either shift up or down or from one side to the other. So there are a few abdominal reflexes, not usually done that commonly. So basically you're taking this end of the reflex hammer and then you struck on the skin and you watch for the umbilicus to move to that side. And then T10 to 12. Okay, so the T7 to T9 is going to be above the umbilicus here, and then T10 to 12 is going to be down below the umbilicus. So if somebody's had surgeries or they have a lot going on their abdomen, they may not be sensitive enough to elicit that reflex. So basically the dermatomes pretty much just follow around. So there is a little bit of variation. It's not quite always as simple as this map right here, because if you see like people have herpes or something, there is a little bit of a zigzag pattern. But again, you're not going to be doing so much with dermatomes, because usually when we're talking about evaluating nerve roots, you're talking about disc herniations, things like that. And it's most commonly going to be brachial plexus, lumbosacral plexus. But just understand the basic process that you do have dermatomal areas on the thoracic spine, on the torso. As you can see here, I mean, when you have herpes, it follows the path of the dermatomal nerve root. Okay, so now we're getting into the monotomes for the lower extremity. So L1 and L2 are going to be the same. Basically, it's going to be hip flexion. Okay. And so again, I mean, these dermatomes kind of basically wrap around on the lower extremity. It's a little different on the upper extremity, but on the lower, it sort of wraps around like a barber pole kind of thing. So again, it's from like when your legs are developing and growing out as buds, it's out like this. Okay, so this is going to be this. They're lined up more this way, but then when you put the leg down into the anatomical position, that's why it tends to spiral. If you stretch them out like this, then it would be more straight in a row. But then as you come here, you're spiraling it. So basically, L1 is usually going to be here in the inguinal area. L2 is going to be like this. 3 is going to come around here. L4 is going to come down the medial side of the knee, and then medial side of the leg, and then the medial side of the big toe. Then if this was the lower leg. Then L5 is going to be here. S1 is going to be around the side and a little bit to the back. And then S2 is going to be back up here. So again, L1 and L2, the maltome is the same thing. It's hip flexion. And then there is a reflex. I don't know if I'd call that a deep tendon reflex, but the cremasteric reflex, that's only going to work on males, of course. You're going to stroke the reflex hammer on the medial thigh like this, and then the testes should rise up. So then again, L2 is a little bit lower in here. Again, it tends to spiral across like this. Like it follows from the actual L1 area. It's going to go here. L2 is going to come around like this. So I'm spiraling down. And then now L3 is going to be knee extension. Okay. So L1, L2 is hip flexion. L3 is knee extension. And then also you could do the hip adductors. And L3 is not going to have a DTR. So L3, now we're starting to get closer to the knee. So it's just on the medial thigh, just proximal to the knee. And anterior, so anterior and medial. Yeah. And then the L4 myotome is going to be like tibialis anterior, so it's going to be inversion up like this. You're going to be pressing down like that. So we'll go through and practice these in a bit more detail. But basically it's like, because this is the tibialis anterior muscle right here, right? The action of the tibialis anterior is dorsiflexion and inversion. And then the deep tendon reflex is going to be the patellar. This is pretty much the common thing whenever people think of reflex, this is probably the most common one. And then again, L4 dermatome is going to come down the medial leg from the knee and then to the medial side of the big toe. And then the myotome for L5 is the extension of the big toe. So you're pulling the toe up like that, and then you're going to press down and you have them say, don't let me move your toe. Right? And you can also do the gluteus medius. With the patient on their side and pressing down like this. But usually you would pull down here at the ankle. The gluteus medius is a abduction at the hip. And so in this case, we skip L5. There's no reflex for it. Although in the textbook they do mention there are some reflexes you can do for L5. But you're not necessarily be responsible for that. So then L5, now if this was the lower leg, then L5 is going to be anterior calf and then dorsum of the foot. So it's going to be right here. So again, you have L4 is going to be the medial side of the foot and the big toe. The dorsum of the foot's L5, and then S1 is going to be the lateral side of the foot and the little toe. And so then S1 is going to be the peroneus, or the, what do we call them now, fibularis muscles. So it's going to be plantar flexion and ankle eversion. So if this was a foot, it's going to be out like that. So this type of movement. Or you can also do the gluteus maximus, which basically the patient would be prone, and then you test resisted extension of the hip. And then Achilles is the reflex for the S1. Grab one.